Hi, everyone. I'm Sarah Song. I'm coming to you from the American Academy of Neurology, where our tagline is Brain Health for All. Thank you for asking me to be part of this panel. I'm going to be speaking a little bit about one of our flagship programs in advocacy called Neurology on the Hill. I am an associate professor and a stroke neurologist at Rush University Medical Center in Chicago, Illinois. I'm also a member of the AAN Advocacy Committee, the chair of the AAN Advocacy Engagement Subcommittee, and a member of the AAN Brain Health Committee. So Neurology on the Hill is the AAN's largest advocacy event, and our goal is really to increase awareness of neurology on Capitol Hill. Almost 200 neurologists come together once a year from across the country to Washington, D.C., and we gain insights from congressional leaders, consultants, and academy staff about the political process. So after a full day of training, we take the AAN's message directly to senators and representatives in our districts. And there is really tremendous value in training and educating legislators and physician members on high-profile issues that affect neurology. And engaging members in advocacy is paramount to the AAN's success and expanding our grassroots network. So the NOH is overseen by the AAN Advocacy Committee and aims to increase awareness of our top advocacy issues for the year and to help AAN members build relationships with our members of Congress. So we have been around for over 20 years, this program has, and we started with 30 attendees. And we now have about 200 annually. So you can see sort of the difference in the pictures. We had to find a new place to take the picture. But what I love is that we really do come together, and it's people with like-minded sort of, fire in our bellies and advocacy, and we really feel passionately about the practice of neurology, and we want to protect it. We've had attendees from 45 or more states per year. Never 50, but maybe this year is the year. How the program works is that attendees will arrive on a Sunday to Washington, D.C. On Monday, we have training all day, so in priority issues, in advocacy, and in how to do a Hill visit. And typically, we'll do some mock Hill visits where we'll have maybe a staff member pretending to be a legislator, and then we'll have some advocates come up and pretend to go through what the issues are, bring up patient stories, bring up stories from our, clinical practice that really accentuate sort of our unique skill of being a practitioner who understands the issues and explaining those issues to our legislators. On Tuesday, that's the day that we actually meet with our senators and our representatives, and then we depart. So it's a really fast 2.5 days, but super fun and super engaged. This year, our event is going to be February 23rd to the 25th at the Grand Hyatt in Washington, D.C. And applications are open until November 19th. So I really encourage you to apply. And you don't need to have a public policy background. You just need to have a passion for neurology and the desire for positive change. And any AAN member of PGY2 or higher may apply for Neurology on the Hill. So we typically have a really good mix of trainees and veteran people who have been there before, and from all different kinds of practice types. So private practice, academic, you name it. Unfortunately, people who would not be eligible for the program are students, interns, and senior AAN members, or non-US residents. So that is something to keep in mind. So our goal is really to have as many unique congressional districts represented as possible. I mentioned that we're always trying to get 50 states, and we haven't gotten there yet, but we've gotten really, really, really close. I think the closest we've got is 48 or maybe 49. And we always do receive more applications than available spots, but we do keep like a robust wait list. So if you're not accepted right away, I would just stay on the wait list, and hopefully we'll be able to get you in. If not this year, maybe another year when you apply. There is a registration fee. It's very minimal. It's $150 per general attendees and $50 for junior members and local attendees. But we do cover airfare and 2 nights of lodging and your meals and things like that, transportation, all that. So I have been to Neurology on the Hill over 10 times. I've sort of lost count. But each time it's been really fun and really rewarding. And, I found each time to be different. We have different issues that we talk about each year. And the group's always different. So some people I get to see, year after year. It's great to see, especially familiar faces in the legislators' offices. So, for example, there's a gentleman who's a senior staffer at Danny Davis's office from Illinois who I saw every year. So we developed sort of a cordial, friendly relationship. And they actually reached out to me when there was an issue at hand that they wanted to know the neurologist's perspective of. And that's really what we want to do. We want to create relationships where they know that we can, we're happy to serve as experts for them and to give us the opinion from the clinical perspective. We've had some great successes through Neurology on the Hill advocacy. So, for example, in 2020, we lobbied for telehealth flexibilities that were established under the public health emergency during COVID. And then again in 2022, we successfully lobbied for the 2-year extension of those programs so that patients could safely access neurologic care through telehealth. In 2019, we successfully lobbied Congress to stop a proposed consolidation of the E&M codes, which would have been extremely detrimental to neurology and other cognitive specialties. And over multiple years, we've successfully lobbied for an increase in the budget for the Brain Research through Advancing Innovative Technologies program at NIH, which has helped to fund cutting-edge research into how the brain works. Over multiple years, we've successfully lobbied for increased funding for the 4 neurology centers of excellence at VA Health, so helping American veterans access high-quality neurologic care. But I'll say that it is absolutely harder than it used to be to pass bills at the federal level. So anything with a cost does require an offset, and it's harder and harder to find cost savings to offset any spending. So health policy in particular is very expensive, and Congress doesn't take into consideration any savings from preventative medicine. And Congress is also just more complicated, and I would venture to say it's become even more complicated this week. So partisanship is high, and with narrow margins in both chambers, it's very easy for a very small group of legislators to gum up the works and stop things from happening and prevent bipartisan policy from going through by taking up valuable time on the House and Senate floor. So there's also a lot more people getting into advocacy. So legislators and their staff are really overwhelmed. They're bombarded with messages every day about any number of groups, ranging from physician groups like us to trade associations to bowling alley owners, you name it. So that's why it's so important that we have neurologists and members of the neurology care team contact their legislators and show them just how much support there is for the policy priorities in our states. So you can visit AAN.com advocacy to learn more about how you can get involved. And with that, I want to say thank you, and I appreciate your time, and I hope that you'll consider coming to our next event. Thank you so much.